Good morning. My name is Michelle Rhodes, and I'll be your instructor today for how to assess vital signs in the adult. In this video, we are going to first discuss what vital signs are. I will be including review questions after each section, and we're going to do some practicing in class afterwards. First of all, what are vital signs? There are 5 vital signs that we're going to review: blood pressure, heart rate, respirations, blood oxygen saturation, and body temperature. Why is it so important that we do accurate vital signs? First of all, they're often the basis for so many treatments. You have to know what the vital signs are before you know whether or not you can give a medication, if you need to adjust oxygen or BiPAP settings, ventilation settings. You need to know if it's safe to give a medication for pain, so you need to know what the respiratory status is. It also establishes the baseline for the patient. You need to know if the patient came in hypertensive or hypotensive, or is it because of a treatment we've given? Is their conditioning improving, or is it deteriorating? It tells us if the treatment that we're giving is working. If it's not, we need to change something. And it is absolutely the fundamental and the most important part of your assessment. You should always start with your vital signs. The first vital sign we're going to review is a blood pressure. This is one of the most common vital signs to be taken. Things to consider are what the difference is between the systolic and the diastolic. Where do you put the cuff? How do you place the cuff? What size of cuff do you use? And what about activity? How does that affect your blood pressure? When you first start taking the blood pressure, you should pump it up roughly until you can no longer feel the radial artery. That's going to be the artery or the pulse point at the wrist. Deflate the cuff and re-pump it up to that point. Listening very carefully with your stethoscope. Note when you first hear the heartbeat. That is going to be your systolic. Now, systolic means that the pressure in the blood vessels is enough to overcome the squeezing of the cuff. Hence, if you have a high pressure in the arteries, your top number, the systolic, is going to be higher. Your bottom number is when there is not enough pressure from the cuff to occlude the artery at all. So there is no sound after that to indicate the blood being pushed through the artery against the pressure of the cuff. That's your diastolic. If you look at the picture here, you can see where it points out that the systolic and where the diastolic occur. This varies from person to person. And again, this is one of the reasons that blood pressure can be one of the most important vital signs you can take. Typically, the manual cuff is going to be more accurate than an automated cuff, such as the ones you see in the hospitals where it pumps up automatically. Remember, if you're ever in doubt about the accuracy of your blood pressure, take it manually. Normal blood pressure is 120/80. This is the textbook blood pressure, and it is the blood pressure that the American Heart Association recommends for all patients. If you look at this screen here, this is a snapshot from the current American Heart Association blood pressure categories. And you can see on here that it's actually recommending less than 120 and less than 80, anywhere between 120 and 129 is considered elevated blood pressure. Now, over the years, the names for this has changed, but currently they have a stage 1 and a stage 2. It's not until you get to stage 1 that your readings start to be affected, or your category classification is affected by both the systolic and the diastolic. On the systolic, anything between 130 and 139, and on the diastolic, anything between 80 and 89 is considered stage 1. Stage 2 high blood pressure or hypertension is greater than 140 or greater than 90 diastolic. Once you get into anything greater than 180, that is considered hypertensive crisis. And these are the patients that you see coming into the hospital. They'll come in either hypertensive urgency, which is slightly less severe, or hypertensive crisis, which is again with a systolic greater than 180 or a diastolic greater than 120. Now let's take a moment and discuss where you place your cuff. There's a couple of different places you can put it. If you're doing a manual, the best place to put it is going to be about 1 inch above the antecubical on either arm. And that's assuming that there's no restrictions against using that arm, such as lymph node removals, wounds. Obviously, if you have an IV access, there you don't want to put it there. But typically, if you use that, then you can take a manual cuff pressure using that location. It can also be used for your automated readings. If you're using automated readings, you have a couple more options. You can put it above the radial artery by the wrist. The reason I say only with the automated is because you have a harder time hearing the occlusion and the reopening of the arteries if you use it at the radial. It is an option, but it is very difficult to hear that. So your best place is going to be about 1 inch above the antecubical. And it's very important to remember that. One of the most important decisions when taking blood pressure is what size of cuff to use. If you use too small of a cuff, your blood pressure will be inaccurately elevated. Too large of a cuff, and it will be decreased. So how do you decide on what size of cuff to use? The American Heart Association recommends that the length of the bladder portion of the cuff, the part that fills up with air, should be at least 80% of the circumference of the arm. The width of the cuff should be about 40%, at least 40% of the distance from the antecubical to the top of the arm by the shoulder. What does this mean then? It means that when you are taking a blood pressure, you want to look at the circumference of the person's arm. So it means that you're not going to use the same size cuff for every adult. For example, you can see on the screen here that I've shown 6 different cuff sizes. The very smallest is the infant. You're probably not ever going to use that on a person, an adult. The pediatric size, I have used that on adults who were very thin, who had no muscle mass, but most commonly, I'm going to be using the small adult. And then sizes go up to the medium adult, the large adult, and the leg cuff. Now, I know earlier I did not mention taking a blood pressure in the leg. You can, but you have to use the correctly sized cuff. When you get patients who are obese, who have very large arms, sometimes you have to use the large adult or even the leg cuff. But remember, it still has to fit on the arm. The last thing to remember about taking blood pressure is in relation to the activity of the person. How many times have you gone to your primary doctor and they walk you down the hall to the examination room, you hop up on that little table, and the medical assistant immediately takes your blood pressure? probably going to be elevated. Your blood pressure is naturally going to elevate with activities such as walking. The correct way to do this, to get the most accurate blood pressure at the moment, is to let your patient sit. Have them reclined in a chair. The arm needs to be rested so that the blood pressure cuff is at level of the heart. Try to put them at ease. I wouldn't be giving them a shot and then immediately taking their blood pressure if they have a phobia against needles. You want them relaxed and calm, breathing normally. Pop quiz number 1. What is the normal range of your systolic blood pressure? Is it A, less than 100, B, less than 80, C, less than 120, or D, less than 140? Mark your answer on your sheet provided. Pop quiz question number 2. What is the normal range of diastolic blood pressure? Is it A, less than 100, B, less than 80, C, less than 20, or D, less than 40? Mark your answer. Pop quiz question number 3. Where should your blood pressure cuff be placed on the forearm? And we're talking about ideal location here. Is it A, above the wrist, B, below the intercubicle, C, about an inch above the intercubicle, or D, around the neck? Question number 4. When do you first hear the pulse while releasing air from the cuff? Is it A, when the artery first opens, B, when the vein first opens, C, when the artery closes, or D, when the vein closes? Now we're going to look at heart rate. We're going to discuss how fast it is or how slow. We're going to discuss where we can check it, and we're going to discuss its character. For a normal, healthy adult, the normal heart rate is between 60 and 80. Anything above 100 is considered tachycardia, or fast heart rate. Anything below 60 is considered bradycardia, or slow heart rate. There's a couple of things that can cause these things to occur naturally. If you have somebody who's an athlete, they have increased cardiovascular fitness, their heart pumps more efficiently, their resting heart rate might be below 60. If you have somebody who is just come running down the hall, they're late for a doctor's appointment, or you've just given them a shot, or they're having a fever, those things can cause your blood pressure or your heart rate to increase and be greater than 100. All these things need to be taken into consideration. Another thing, as a nurse in the hospital caring for the patient at bedside, to remember is vital signs are trended. You look for changes over time. Let's say you have a patient who, when they come into the hospital, their resting heart rate is in the 70s. And you're on night shift and you're watching this patient's heart rate. And over the course of a few hours, while they're sleeping, they're not excited, they're not watching TV, you start noticing that heart rate is climbing into the 80s and the 90s. You want to go ahead and notify the doctor. You don't necessarily have to wait till it breaks over to 100 to let them know. Now, when you're in the hospital and you have your patients on telemetry monitoring, you'll go ahead and have the heart rate and the EKG strips right there for you at your convenience. But let's say you don't. Let's say you want to go over there and check them manually. There are multiple places you can check it. I'm sure I've highlighted the most common places to check it. You have your carotid artery there in the neck. Your brachial artery, which is where you put your stethoscope when you're taking your blood pressure. Your radial artery, which is probably the most common place to check somebody's pulse. The femoral artery. Femoral artery is the largest artery outside of the aorta, and it is usually a very good place to check, especially in emergencies. Your popliteal artery behind the knee, and your post-tibial artery there in the foot, and on the top of your foot, the dorsal pedis artery. Now let's talk about the character of a pulse. This is not a character witness of somebody, are they devious or are they kind-hearted? We want to know just how well you can feel it. You want to know the rhythm, the rate. You want to characterize, is it strong or can you barely feel it? All these things can tell you an immense amount of information on the patient's cardiovascular status. They may have a heart rate of 95, but if it can be barely felt, then that makes me concerned about their blood pressure. Or it could be bounding. Are they excited? Is their blood pressure high? These are all things you need to take in consideration. Pop quiz number 5. What is the normal heart rate for an adult? Is it 40 to 60, 60 to 80, 80 to 100, or 100 to 120? Question number 6. Name 4 common places to take a pulse. Select all that apply. Radial, axillary, popliteal, femoral, brachial, or chest. Now we're going to look at respirations. Normal respirations for an adult are between 12 and 20. Respirations is one of the most commonly inaccurately measured and recorded vital signs. If you look at the vital signs readings on a unit in a hospital, it's not uncommon to see everybody down the hall is apparently breathing 18 or 20. These have to be counted. The easiest way to count is to count for about 15 seconds and multiply by 4. Or if you're uncertain about the number or the character of it, go ahead and count for 460. You want to look at the character of it. What's the rate? The rhythm. Is it shallow, deep, regular, or irregular? Is the patient labored or unlabored? And also, respirations can be a harder one to take because you think about how hard it is for a person to breathe normally when you say, oh, I'm going to count your breathing. They immediately become aware of it, they become self-conscious of it, and they try to breathe normal, but it's not accurate. So one of the tricks that I do is I'll pick up the patient's wrist like I'm feeling their radial pulse and gently lay their arm, with me holding the wrist, over their chest. And while we're talking, I'm counting the respirations by feeling it go up and down. They're completely unaware that I'm taking their respirations, and I get an accurate reading. Now let's talk about what you call respirations that are outside of the normal rate. If it's greater than 20, it's considered tachypnea. If it's lower than 12, it's considered bradypnea. Remember again that the respiratory rate is one of the most commonly inaccurately recorded vital signs. And now for pop quiz question number 6. What is the normal respiratory rate of an adult? 8 to 12, 12 to 16, 12 to 20, or 20 to 25. Question number 7. Fill in the blank. A rate faster than normal is called blank. A rate slower than normal is called blank. And now for our fourth vital sign, oxygen saturation. Oxygen saturation is another one of those vital signs that requires careful interpretation to understand the meaning of it. For most people, anything greater than 90 is considered quote-unquote normal. However, in the absence of any other health conditions, pneumonia, for example, I would be a little concerned about somebody whose resting oxygen saturation was only 90. What can cause it to be less than 90? Let's look at things that are non-pathological, such as cool fingers, poor waveforms. When you're looking at an oxygen saturation reading, you expect to see something that kind of looks like your heart rate. You have the up and down that should correlate with the heartbeat. It should be a simple, smooth up and down. You don't have the peaks and the sharp points like you do on the EKG strips, but it should be regular. But there are conditions that will cause people's oxygen saturations to be lower. One of the most common ones is COPD, chronic obstructive pulmonary disease, also includes emphysema. These patients can run chronically low, usually 88 to 92. One of the things you need to ask yourself is, does this person run this way all the time? Is it normal for them? Are they having any distress? Do they look short of breath? How good is the waveform? If you get somebody who is otherwise healthy and they come in with an O2 saturation of 85, you want to be making sure that you've got good connection with your sensor. And if that looks good, you need to be putting them on some oxygen and talking to the doctor. Pop quiz number 8. What is the normal oxygen saturation of an adult? 88 to 90, greater than 90, greater than 93, or 100%? Pop quiz question number 9. What are 2 conditions that may cause inaccurate oxygen saturation readings? Fever, cool hands, poor waveform, or lying in a prone position? Last, we're going to look at temperature. We're going to discuss the normal ranges and the types and locations you can check it. Oral temperatures are the most common way of taking your temperature. This is when you stick the thermometer under the tongue, ask the patient to close their mouth, and the machine reads it for you. The normal range is 96.4 degrees Fahrenheit to 99.1 degrees Fahrenheit. Another way to take temperature is rectally. This is a useful way to take if you need to know the core temperature of the person. You want to make sure that you're using plenty of lube when you put that in there for comfort for the patient. And you only want to insert it about an inch. Go any further, you could risk perforating something. This is a useful way to take it when you cannot otherwise take it orally or any other means. Let's say you have a person whose mandible is fractured and they have their mouth wired shut. The temperature range for rectal is 97.4 to 100.1. Rectal is typically going to be 1 degree warmer than what you would get orally. So let's say you get somebody's rectal temperature is 100, then you can estimate that the oral temperature would be about 99. Now, there are other ways you can take your temperature as well, and that includes axillary, which is under the arm. You can take it with sensors that read up here by the temporal pulse, and there are also ones that you can take in the ears. But oral and rectal are the most common types. Now, I want to tell you a little story about taking temperatures. I worked with a group of students once, and they were very eager to help. They wanted to do anything they could on the unit. It was the first, second day of clinical. And so myself and the other nurses, we asked them if they could take temperatures for us, or vital signs. Well, I saw one of them come out of a patient's room, and they were holding one of the thermometers. The thermometer had a red tip. And I stopped the student and I asked him, I said, "Did you just take an oral temperature?" She said, "Yes." And I said, "Did you use a probe cover on that?" And she goes, well, yeah, of course. I said, "That's a good thing." Remember, the red tip thermometers means rectal. I don't think she made that mistake again. All right, last question, pop quiz question number 10. What is the normal oral temperature range? 96.4 to 99.1, 94.4 to 97.1, 99.4 to 100.1, or 96 to 99.9. Mark your answer. After this, we're going to go over your quiz. Now I want everybody to look to the student to the left or to the right, and let's switch papers so we can check our grades. For question number 1, what is the normal range of systolic blood pressure? According to the American Heart Association, normal systolic is less than 120. Congratulations to those who marked C. Question number 2, what is the normal diastolic blood pressure range? According to the American Heart Association, a healthy diastolic pressure should be less than 80. Question number 3, where should the blood pressure cuff be placed on the forearm, ideally? Answer is C, 1 inch above the antecubical. Question number 4, when do you hear the first sound when releasing the air from the blood pressure cuff? The answer is A, when the artery first opens. This means that the pressure in the artery is great enough to overcome the squeezing pressure of the cuff. Question number 5, what is the normal heart rate for an adult? The answer is B, 60 to 80. Even though a heart rate less than 100 is not considered abnormal, normal resting heart rate for an adult should be 60 to 80. Question number 6. Select 4 common places to take a pulse. That includes the radial, which is by the wrist here. It includes the popliteal behind the knee, the femoral, which is in the groin, and the brachial, which is here where you would take your blood pressure. Question number 6. What is the normal respiratory rate of an adult? The answer is C, 12 to 20. Question number 7. Fill in the blank. A faster than normal respiratory rate is called what? The answer is tachypnea. Slower than normal is bradypnea. You can remember that by tachy, meaning fast, like tachycardia, tachycardia or tachypnea. PNEA means breathing. And of course, the bottom one there, the Brady means slow. Of course, when you're talking about this, it's pronounced bradypnea. Question number 8. What is the normal oxygen saturation for an adult? That would be B, greater than 90%. Number 9. What are 2 reasons or conditions that may cause inaccurate oxygen saturation readings? That would be B, cool hands. You don't have the circulation, you're not going to get an accurate blood flow, you're not going to get an accurate reading. And C, poor waveform. Recheck that sensor, you might have to move it, get a new one, but the sensor needs to be replaced. And finally, question number 10. What is the normal oral temperature range? And the answer is A, 96.4 degrees Fahrenheit to 99.1 degrees Fahrenheit. And now we're going to do some practicing. Everybody, you should gather your blood pressure cuff and your stethoscope. You should have an oral thermometer, meaning it is not a red-tipped thermometer. Your oxygen sensor. Grab a partner, and let's get started. If you would please also pass your sheets up so it can be collected and graded afterwards. Thank you.